Just really coming to the end of Northumberland CCG's Health Forum here in Guidepost this morning, which has been a really positive experience and loads of energy in the room, talking about particularly clinical integration, how we wrap services in a much better way around patients. The NHS appears as one body sometimes, but a lot of the times actually feels as lots of silos, lots of people working in isolation, and what we're trying to do, very much focused on patients, is actually trying to wrap the whole thing together so that from your GP, your community nurses, your practice nurses, through to the most specialist of specialists, it feels much more joined up, shared, everybody pulling in the same direction, which has to be the right way to go.
I'm here today on behalf of Healthwatch Northumberland. I'm chair of Healthwatch Northumberland, and I'm here working with the facilitated engagement session for the Northumberland Clinical Commissioning Group. What's really important, the message that we want to give out to today, is all the decisions in commissioning and designing services is about listening to the people of Northumberland, listening to the patients about what is important to them. Today is one of those days where we demonstrate our close partnership working in Northumberland with the healthcare commissioners, with providers of services, and also with the voluntary sector. It's absolutely key that we work together in partnership. What we're looking for, and what we're all looking for, is actually good health outcomes for the people of Northumberland. And we want to listen to the patients of Northumberland. Most importantly, we want to hear what you're saying. We want to hear what your views are on the health and social care services in Northumberland. That's what's key, and we'll continue to do it.
We're in Choppington this morning, talking to the residents, not just of Choppington actually, but from quite far afield. For example, there's somebody from Wooler, there's somebody from Hexham, there's somebody from Morpeth, and they're particularly interested in our discussions about merging health and social care. Some interesting questions at the beginning of the meeting about what is social care as opposed to health care, and now as we're going around the tables, it's very interesting to hear their views on what is working well, what isn't working well, how our PACS arrangements can change things for the better. And PACS is primary and acute care at scale, is what it's short for. And what it's about is getting primary care to work at a larger scale across the whole patch of Northumberland, so that people aren't divided into small silos, practice by practice, but have access to primary care 7 days a week over longer hours, possibly at their own GP surgeries, possibly at regional hubs, regional in our terms, so that they can go out of hours and still obtain primary care before work, after work, in a common hub where there are probably more than just their GPs but other related facilities as well. So it should be a big benefit for the people of Northumberland, particularly